Your testosterone will never decrease if you do this. The hormone testosterone is generated by the body, mostly in men's tests. Men's health is impacted by testosterone in a variety of psychological and physiological ways. Testosterone promotes pubertal development in male adolescents, which includes the growth of facial hair and muscles. However, testosterone is still significant in maturity. For male fertility and reproductive health, testosterone is essential. Your ability to get and keep an erection and ejaculate, as well as your ability to produce healthy sperm, can all be impacted by abnormal testosterone levels. As we travel through our life cycles, our hormones change. A 20-year-old's normal is not the same as a 60-year-old's normal. Join me as we explore our options for preventing testosterone decline. 1. Maintain ideal body weight. Probably the most significant action a man can take is this: the aromatase enzyme, which changes testosterone in fat cells into estrogen, becomes more active as belly fat grows. This causes an increase in estrogen and a decrease in testosterone, which can lead to an increase in fat accumulation in typical feminine areas and an increased risk of prostate enlargement and even prostate cancer. Your testosterone level will rise by about 1 point for every 1 point decrease in your body mass index. In fact, controlling obesity may stop aging men's total testosterone levels from falling. 2. Prevent the first sign of diabetes. The chance of having a total testosterone level below the normal range rises with the development of diabetes. In diabetics, the chance of acquiring unusually low testosterone levels more than doubles during a 10-year period. 3. Sleep well. Rapid eye movement deep sleep is when the majority of the body's testosterone is produced. Low testosterone has been linked to an interrupted sleep pattern with less time spent in rapid eye movement. 4. Avoid opioid painkillers. Opioids such as morphine lower testosterone. This can continue while a patient is receiving opioid drug treatment for months or even years. After using opioids, levels can decrease as soon as a few hours later. It seems that the likelihood of low testosterone increases with opioid dosage. Fortunately, after the painkiller is stopped, this side effect ought to go away. Of course, you should always speak with the prescribing physician before abruptly stopping or altering your pain medication. 5. Avoid tobacco and excess alcohol. Low testosterone levels have been linked to heavy alcohol intake, according to studies. This is due to the fact that alcohol and tobacco use reduce the brain's luteinizing hormone production, which in turn influences the creation of testosterone. Alcohol abuse can also affect the development of sperm. Even while there are therapies for low testosterone, many men would rather begin by adopting the positive lifestyle adjustments that will raise their testosterone levels on their own. The above-discussed changes are more important for maintaining healthy testosterone levels than any supplement. Your doctor can also suggest testosterone treatment, help you choose which of the aforementioned lifestyle modifications could be most beneficial for you, and send you to other professionals who can assist address any underlying medical conditions that may be causing your low testosterone levels. Hope this video helped. Thanks for watching.